My name is Ian Breakspear. I'm a senior learning facilitator at Torrens University. So I work in the area of naturopathy and Western herbal medicine. A lot of people think naturopathy is defined by the tools like herbal medicine, nutritional medicine, etc. But in actual fact, it's defined by principles like health promotion and disease prevention and trying to get to the root cause of illness and seeing the patient as an individual. I was a really early starter and one of the few that was a school leaver interested in choosing naturopathy as a career. Started studying at Australasian College of Natural Therapies, so 4 years full-time studying naturopathy. And the rest of my career path has been pretty much unplanned. It was certainly not what I envisioned when I first started my training. A few years after I graduated, I received a phone call from one of my former lecturers saying he was going on leave for a few weeks. Would I fill in for him? It was a little scary, but I enjoyed it and obviously must have done okay at it because I've been teaching ever since. For me, teaching is really about paying it forward to the next generation. I was really fortunate to have some fabulous lecturers when I was studying and learned so much from them, and I think we need to pass that on and make sure the next generation benefits from our generation's knowledge and push it forward. I spent 8 years on the board of directors of the Naturopathy and Herbalists Association of Australia. I sit on a couple of scientific advisory panels now as well. And also I'm the naturopathy advisor for the Natural Health Science Foundation as well. An average day for me is not really all that average. So some days I'm obviously teaching and looking after students and developing curriculum. A couple of days a week I'm seeing patients, these days via telehealth. But then other times I might be touring an olive grove during harvest season, or I might be working in an olive research laboratory, doing analysis as part of a research project on herbal medicines. I love the fact that this profession offers me quite a lot of variety, and I can choose the direction I want to take. The pandemic has really changed naturopathy's focus again back to one of the core fundamental principles of disease prevention and health promotion. I think the other thing for me that's really changed is the reach that we have now with something like telehealth. I'm seeing patients in Pakistan, in London, in the US, as well as in Australia via telehealth now, which is something that I would not have imagined a couple of years ago. What advice would I give to somebody starting out in complementary medicine? You see other forms of healthcare and how we can interact with those other areas, and all of our patients are going to be under the care of different types of health professionals. So learning how to communicate, learning how to collaborate with those people. As you go through your training, I think forming connections and forming mentors, really getting out there into the real world is so valuable.